Thank you, Chris, and again, thank you, members of the media, for joining us today and helping us with our messaging. Before we get to questions, we have a few topics that we wanted to cover. As always, we'll start off with some numbers, and as of this morning, Northern Light Health is taking care of 42 inpatients across our system, one of those at A.R. Gould Hospital, one at Blue Hill Hospital, 21 at Eastern Maine Medical Center, 4 at Inland Hospital, 3 at Maine Coast Hospital, 4 at Mayo Hospital, and 7 at Mercy Hospital, and 1 at Sebasticook Valley Hospital. In addition to that, our home care and hospice team is taking care of 6 patients positive for COVID-19 at their homes. Our 2-week positivity rate is 10.33%, and 1-week positivity rate is 10.10%. Those numbers really have not changed much over the past few weeks or from a day-to-day standpoint. And again, that represents the total number of positive tests divided by all of the tests run for Northern Light Health, and that is for tests that are actually ordered, some of those ordered outside of Northern Light Health. We continue to share our COVID-19 hospitalization graphic with the public that details the number of people hospitalized with COVID-19 who are vaccinated and those who are unvaccinated. The numbers continue to show that those who are vaccinated have lower cases of hospitalization and severe illness. As we noted before, this graphic represents a snapshot in time, and the data is changing constantly. Today's graphic will be shared in the chat and will be available on our Facebook pages. It's no secret that we continue to be in one of the most difficult phases of the pandemic. Given this, we'd like to provide an update on some of the specific challenges we're facing at Northern Light Health. The difficulties we're experiencing are similar to what's occurring at most, if not all, healthcare organizations in Maine. Demand at our hospitals remains significant due to the high number of COVID-19 patients in our care. Additionally, as we've talked about before, those who delayed care during the pandemic are coming to us sicker and with more complex health issues. Capacity constraints in long-term care has also had a ripple effect through Northern Light Health. As of this morning, 111 patients in our system are medically cleared to be discharged to a long-term care or skilled nursing care facility, but remain in our hospitals waiting for beds. This affects capacity in our hospitals. On any given day, dozens of patients at our rural hospitals may need to wait for a bed to become available at Eastern Maine Medical Center before they can be transferred. The availability of behavioral health beds also continues to be an issue, as it has been for several years. Many patients who could benefit from beginning their care at a behavioral health facility right away spend far too long in our emergency departments waiting for a bed to become available. In the short term, these patients benefit from the excellent team from Acadia Hospital that is embedded in many of our emergency departments in the region. In the long run, the project to expand Northern Light Acadia Hospital will make a difference, but for now, the lack of behavioral health beds continues to reduce capacity in our emergency departments. Despite these challenges, we continue to be available and ready to meet the needs of our patients with COVID and those who turn to us for other essential healthcare needs. To do this, we've had to continually assess our resources and capacity and remain flexible to meet the needs of our communities. For example, the timing of some procedures may be adjusted when it's safe to do so for patients who are likely to need inpatient care after their procedure. So for anyone in our communities that needs care, please know that we are here for you. You may need to wait a little bit longer for care if your needs are not urgent. While our emergency services remain open, we do urge people to seek non-emergency care at our primary care offices and walk-in care sites if they are able to do so, or even consider our statewide virtual walk-in care service, which is now available 7 days a week anywhere in Maine. We're working hard every day to adjust what's a truly unprecedented time in healthcare, and we appreciate your patience. And now I'm going to turn it over to Paul for some more talk on this subject.
Thanks, Dr. Jarvis. And so we always provide detail in terms of the vaccination rate among our employees. And as we are in the final week prior to the state mandate going into effect at midnight this Friday, we have 97.66% of our staff vaccinated as of about 36 hours ago. We will be reviewing our data to refresh that. We've had employees come forward and share with us vaccination cards demonstrating that they've been vaccinated for a period of time and just hadn't shared it with us at this point. And so we're certainly happy to receive that information and continuing to receive vaccination cards, and as well new staff coming forward who have not yet been vaccinated, making the decision to become vaccinated. And we'll work with those staff to provide them time away from work during which they can take their paid time off if they choose to, between the time of this Friday and the time on which they're fully vaccinated, as per the state definition, meaning 14 days following their final dose of vaccination. And so we continue to work with staff in that regard and continue to answer questions both of community members, staff, and et cetera, regarding vaccine efficacy and safety, and provide that material on an ongoing basis. So we're looking forward to receiving more vaccination cards and more staff stepping forward to become vaccinated here in these final few days. And now we'll open it up for questions.
Got a few more things. Yeah. I do want to give an update on vaccination before we get to questions. So Northern Light Health is now offering booster shots for the Moderna and Johnson & Johnson vaccines in addition to the Pfizer vaccine. Scheduling for booster vaccines is available on Northern Light Health's website or by calling 207-204-8551. We started booster vaccine scheduling for both Moderna and Johnson & Johnson on Monday, and the process has been smooth. We are offering mix and match vaccinations as well for those who want a different vaccine for their booster. This is a good choice for people who did not tolerate their initial vaccine brand, and it also may be beneficial for those who receive Johnson & Johnson to receive a Moderna or Pfizer booster. As we've shared before, while the boosters are important, the best thing that we can do to stop a serious illness from COVID-19 is to ensure that every eligible person completes their initial vaccine series. If you haven't already been vaccinated, it's definitely not too late. For more information about eligibility for boosters and how to sign up, please visit our website, northernlighthealth.org. As you are undoubtedly aware, the FDA advisory panel yesterday recommended the Pfizer vaccine for children ages 5 to 11. The panel recommendation is only one step in the process. We will be prepared to move forward if and when the vaccine is authorized for younger Mainers by the FDA and the CDC. While this is the same messenger RNA used in the adult vaccine, it is a different dose and will be packaged as a different vaccine to ensure safe administration. If and when vaccinations for this group are approved, which could happen as soon as early to mid-November, we'll make it as easy as possible for younger folks to get vaccinated. We look forward to sharing more information as it becomes available. And with that, we will now open up for questions.
Thank you very much, Dr. Jarvis and Paul. Yeah, a lot going on this week to try and cover. So first up, we're going to go to Owen Kingsley from WABI. And Owen, you should have the ability to unmute yourself and ask your questions.
Perfect. Thank you, Dr. Jarvis. First question I had was Maine Health recently shared that before the pandemic, they were looking at about 10% of their positions were unfilled, and because of the vaccine mandate, that's increased it to about 12%. Do you guys have the same or similar numbers, or any kind of context you can provide of the number of positions that were unfilled before this vaccine mandate came into effect?
Sure. We had about, on an ongoing basis prior to the pandemic, and we had around 1,100 positions open, and that's been a typical number that we've had for some time. During the course of the last several months and weeks, we've elevated that up to about 1,700. I'm not attributing that to the vaccine mandate, really. In large part, I think the overall workforce shortage that we're seeing in our state and our country has more to do with that than the vaccine mandate itself. But certainly that plays a part. But it's not the full picture.
Okay, thank you. And my second question was, we're about 6 months away from when anyone who was 12 and older could get the vaccine and had become fully vaccinated. You were just mentioning being able to set up appointments for booster shots. Are you seeing a lot of those appointments being filled? Are you concerned about the long-term effects of people not getting the booster, thinking that they're okay with their current vaccination status?
So I'll just reiterate once again that for most individuals age 18 to 65, a booster vaccine is not necessary. Really for that age category, if it's somebody who has a serious health condition, they may want to consider that, or if they're in an occupation where they would have a significant exposure to people of the public, such as first responders, healthcare workers, teachers, those working in food industry or grocery work, where again they're coming in contact with multiple individuals who are from the community. So that's really what the advisory is. For those age 65 and above, the recommendation certainly is for them to get a booster shot. And now with the new recommendations for those who receive Johnson & Johnson, it is recommended now that after 2 months after they receive their first dose, they should receive a second dose as a booster, and so that actually applies to anybody over the age of 18. But we still know that the majority of individuals who were vaccinated between December of last year and now continue to have adequate immunity to help prevent hospitalizations and severe disease. What we're seeing more in these breakthrough cases, they tend to be milder and less severe, as we've talked about before. But again, there's always that discussion about whether or not they can transmit the virus even if they remain mildly ill or asymptomatic. And we do know that while they don't transmit the virus to another person as well as somebody who's unvaccinated, that's still a possibility. So we do encourage those who meet eligibility requirements to get a booster for that particular reason. So thank you for that question.
Thank you very much, Owen. We're going to move on now to Corey Bouchard from WAGM. Corey, you should be able to unmute yourself now and ask your questions.
Thank you, Chris. So my first question is, with the new Pfizer dose, the mini dose for the children there 5 to 11, it hasn't obviously been fully approved or fully authorized from the CDC and all that panel like that. But I have heard that some of the other hospitals have started pre-ordering their doses there. Have you guys started that ordering process? And if so, what are you looking for quantity-wise for that first purchase?
So Northern Light Health has entered into a partnership with the state of Maine, as have many of our large health systems across the state. So we actually have the state that does the ordering for us. We are well aware that the state has begun that ordering process and in fact has vaccine either on its way to Maine or in Maine already. And we will get a sufficient amount for the needs that we foresee in the communities that we serve. As Northern Light Health serves pretty much most of the state, and our home care and hospice agency actually does a great job of being part of the system that will be offering vaccines in schools. We are covered in all of that. So we feel pretty comfortable that we will have enough vaccine in the state of Maine, and particularly at Northern Light Health entities, to cover the need for the number of children that are between the ages of 5 and 11. So I don't have any concerns like we did in the beginning part of our vaccination process that supply will not meet demand. We think we will have an adequate supply.
Thank you. And my my last question here is about the vaccine mandate, which is obviously going into effect a few days from now. A big story, nationwide has been the counterfeiting of and the illegal sale of vaccine cards. Have you guys seen any of that? And maybe what are you doing to try to mitigate that?
In terms of our staff, most of our staff are getting their vaccine from us at one of our Northern Light facilities throughout the state. And so that's not really a group that's ripe for that type of activity. We haven't come across fraudulent cards insofar as I'm aware. I know that the cards that we have typically have not just signatures and information, but oftentimes have label or other information from the vaccine that was administered, making it much harder to duplicate in a fraudulent manner. But Dr. Jarvis, and perhaps in your practice you've seen, but I haven't seen any from our staff at all.
Nothing beyond anecdotal comments, of people saying that there may be some, but I am not aware of any that affected any of our staff at this time.
Thank you for those questions, Corey. Next up, we have David Horowitz from WVII, but I believe that he's having some mic issues. So I'm going to ask his question, and this is directed to Dr. Jarvis. And the question is there been hesitancy amongst parents to have their kids vaccinated that you're aware of?
I'm sorry, I missed the question. Can you just repeat it, Chris?
Sure. Is there hesitancy amongst parents to have their kids vaccinated that you're aware of?
So we do know that. We had that. We saw some hesitancy with some parents just talking about those that are between the ages of 12 and 18. And we certainly have the ability to address that like we've done vaccine hesitancy for everyone. I reviewed the data that got reviewed by the FDA advisory committee. And again, the data is pretty clear. These vaccines are incredibly safe. And they are effective in preventing disease in people between the ages of 5 and 11. And so, again, these are safe and effective vaccines. We don't expect that children would have any more untoward effects than what we've seen in adults, and in adults that has been very extremely rare. And of course, we have hundreds of millions of people around the world who have been vaccinated with each of the 3 vaccines that are currently authorized, and especially the Pfizer vaccine, which is the only one that's indicated for anyone under the age of 18.
Okay, thank you very much for those questions. We're going to move on now to Patty White from Maine Public. Patty, you should have the opportunity to unmute and ask your questions.
Thanks very much. Dr. Jarvis, you mentioned that you've got about 111 people who are ready to be discharged to skilled nursing facilities. Can you just tell us what that number looked like, on average before the pandemic?
Yeah, actually, that's a pretty static number for us, unfortunately. So we hover somewhere between that 70 to 80 up to 120 across all of our hospitals, and that's been a pretty steady number for us even before the pandemic. Again, this has been a challenge that we've talked about before. That frankly, Maine just does not have enough acute care beds or long-term care beds to meet the needs of our population. And so while the pandemic certainly exacerbates that and makes it even more difficult, this has been a long-standing issue for us. The pandemic, I think, just highlighted it even more. And so while those numbers seem extremely high, for us, that's almost commonplace. And I also want to say that's a combination of individuals who need both skilled facilities and long-term care. So it's a combination of the two together.
Okay. And are you expecting that is, you're going to have even more people waiting after this vaccine mandate takes effect, just because there are going to be more staffing shortages with skilled nursing facilities and long-term care? And, I guess, are there any kind of contingency plans to deal with that?
So again, this is something that we need to tackle as a state, and we're hopeful that we can find solutions to this particular issue. I don't think it's going to be the vaccine mandate that becomes the issue for us. Really, it's just the sheer number of people who are needing this kind of service continues to climb. As we've talked about before, COVID-19 just adds to that, as we have people who had been healthy previously who now have been afflicted with either long COVID symptoms or with conditions that are not reversible due to the myriad of complications that patients with COVID-19 can affect. And so it just adds to the problem by having more people who are going to require at least skilled nursing facility or need to have long-term care. And it's a very complex issue, and it'll take complicated answers to find a solution to this problem.
Thank you for those questions, Patty. Jim Keithley, News 8 WMTW.
Thank you, Chris. And Dr. Jarvis, can you hear me?
Yes, I can. Go ahead.
Thank you. My questions revolve around the vaccine hesitancy regarding the children 5 to 11. This will be fast and furious, I understand, over the next couple of weeks when and if the approval comes, which is expected from the FDA and CDC and all that. My question, though, we speak with parents all the time, and what do you tell the parents who may have been the first in line to get their own vaccine but are still hesitant for their young children? They may take the wait and see option. You just mentioned, the data is clear, the vaccines are safe and prevent disease, but what would you tell these parents who are sort of on the fence?
Yeah, so this is that question that we talk about with just about any kind of vaccine, both for childhood and adult vaccines. I'll give a kind of an example of another condition that's kind of the flip-flop of the reasons why. So if we talk about the vaccine against pertussis or whooping cough, for most of our lifetimes that was not available to adults, and it's only been over the last number of years that we've been able to vaccinate against pertussis. And people say, well, why? Whooping cough is not a disease of older people, except what happens is that older people get infected with pertussis or whooping cough, then infect children, and then those children have severe conditions secondary to that. What we're really talking about is the opposite here. So while children typically do not get severe disease from COVID-19, it does affect them. They won't be able to attend school, they'll be quarantined, and there's that isolation issue that we've talked about before. And so getting them vaccinated protects them not only for their own health, but also for their socialization and keeps them in school. But it also protects the other people that surround them and that are in their families. Most families will have somebody that's in their family that's at high risk, even if they've been vaccinated, of having disease from COVID-19. and therefore having it so that the more people that are vaccinated, there are less people that will have the virus, the less spread that occurs, and that way we protect everybody. So it's almost looking at your entire family. How do we protect everybody in the family? How do we protect our children? How do we protect their parents? How do we protect their grandparents and the communities that we all live in? And this is just another tool for that. So it helps kids to stay well, helps kids to stay in school, and helps them to make sure that the people that they love stay here with them. So that's the reasons why.
And Jim, do you have a follow-up question?
I do actually. Calling more on this, on the vaccine for children. We've heard some talk, I guess. I don't know. What's the rollout going to look like? I thought I heard it's going to be in schools. It'll be in the doctor's offices. It won't be, at the mall or these large vaccine clinics. But I think parents would like to hear, because this is going to ramp up fast. Are you in talks with, local school districts, or what will this rollout look like? Because it could be, in as little as 2 weeks from now.
So we've been in discussions for a long time, and as we've talked about before, just about every stage with the vaccine, with the vaccinations against SARS-CoV-2, the virus that causes COVID-19, we have always been doing pre-planning in anticipation for the next event, and we have done that in this case as well. One of the things that we have going for us is that we just did this in the spring for those children who were ages 12 to 18, where we did go out and vaccinate in our schools. We did vaccinate in some of our larger clinics. We've been vaccinating now in our primary care offices and several of our specialty clinics for quite some time now. So we will continue that. Every year we do a rollout of vaccine within schools by doing that, by vaccinating for influenza. This is a great plug for me to also say, get your flu shot now. It's the right time to get your flu shot, and we need people to be protected against influenza as much as we need them to be protected against COVID-19. And so we're good at doing this. We have been coordinating with both state agencies, particularly the Maine CDC and the Department of Education through their School Nurses Association. And so across the state, the healthcare systems and federally qualified health centers and other healthcare agencies have been working with state agencies and local school districts to ensure that once we are able to provide this vaccine, we will be able to do that. The state has asked that if it's necessary to set up special clinics, particularly on weekends, or in certain areas where it is difficult for us to reach school-age children in school, if we would assist in that, and Northern Light Health has certainly said yes, we would assist in that as best that we can, looking at our own resources. So really, we're going to try to make a push that we can make this vaccine as readily available as we possibly can, so that we don't have to talk about things like having large-scale vaccination clinics, which we haven't had to do for booster shots, and I don't expect that we will have to do that for children ages 5 to 12. So thank you for the question.
Thank you very much, Jim. Eric Russell, Portland Press Herald. You should be able to unmute.
Thanks, Chris, and Dr. Jarvis and Paul. Follow-up question to what Jim had said. Are there any challenges, workforce challenges, that are going to make it harder to deliver some of these vaccines to children if and when that comes?
So there's as we've talked about numerous times, we have workforce challenges. There's no doubt about that. But it talks about prioritization. And right now, our single most important priority is to prevent people from getting sick from this disease so we can stem this pandemic and that we can find what our new normal is going to be, but it's got to be better than what we're seeing right now. And so we will put every effort we can, first and foremost, into getting vaccination out while we continue to provide critical, urgent, and acute care services. And we have not wavered from that since day one of the pandemic, and we will not waver from that until we are through the other side of this and we have vaccinated every single Mainer who is eligible to be vaccinated and wants to get vaccinated. And that's my promise, and it's the promise of Northern Light Health.
And more broadly, as you see the positivity rate continue to be at a really high level, and hospitalizations at a high level, and transmission in general at a high level across your areas, are people, do you get the sense that people are just not taking the same precautions that they were several months ago? They're just willing to say, I'm done with these precautions, I'm going to live my life and let the chips fall where they may? Or is it just a function of the Delta variant being so transmissible, or is it some combination of both? I don't know.
Well, I think it is a combination of things. I'm not saying that people are going out there and saying, I'm just going to let the chips fall where they may. But human nature is human nature, and we get tired of doing things. Things are going well, and so we let our guard down, and that's really what I think happens. We let our guard down. People aren't wearing masks as often as they should be while they're indoors in public spaces. We know that there's an increased number of gatherings, and so that's always a chance that we spread virus and other respiratory illnesses a little bit quicker. And then there is the Delta variant, which we know is more infectious than prior prior variants of the virus that we've seen before. Travel is another thing. Certainly, travel has now become a lot more. People are traveling a lot more than they were before. So it's that combination of factors for us. But again, when we look at severe disease, particularly those that require hospitalization, it is people who are not vaccinated. So the single best thing that you can do is get vaccinated. And then remember all those rules that we've talked about. Wear your mask while you're indoors in a public place. Don't gather in large settings if you can avoid it. Do appropriate physical distancing. Wash your hands often. And please, if you're not feeling well, stay home. That's a key and critical point to protect us not just from COVID-19, but from the virus that causes the flu and other respiratory viruses that we know track around this time of the year. And so that's a key important thing, and I hope that's one of the lessons we learned from the pandemic, that it's okay to stay home when you're not feeling well. In fact, it's not just okay, it's the right thing to do.
Thank you.
Thank you.
Thank you for those questions. Eric, we're going to move to David Marino from the Bangor Daily News.
Sure. This is for Dr. Jarvis. Right now, the breakdown in Penobscot County is, 64% partially or fully vaccinated, 25% unvaccinated, and 11% ineligible. With that ineligible number dropping significantly, with 5 to 11-year-olds being able to get the shot soon, are you hopeful that Penobscot County families will go out and help bring the county closer to herd immunity?
Yeah, I'm very hopeful that we continue to do that, not just here in Penobscot County, but in all of our counties. As we know, there's substantial spread or high spread of COVID-19 across the entire state right now. And so, we need to do some things to make this better. We want to make sure that our kids stay in school. We know that their best learning experiences is an in-person learning, and we want that to continue. But we continue to see outbreaks that happen in schools and in other entities, which then require things to either be in quarantine, shut down, or whatever word you want to use. None of those are good things for us. And so, yes, I'm hopeful that this will just expand out. Again, very proud of the state of Maine and Mainers. I believe that now 75% of all eligible Mainers are now fully vaccinated. That puts us in the top 4 or 5 of the country. And I'm proud of the fact that Northern Light Health was a part of that, but more proud of just Mainers standing up and doing the right thing. And we just want to encourage that to happen. If there's anyone out there who continues to have questions about the vaccines that are particular against COVID-19 or about vaccines in general, please reach out to a trusted source that's reliable and has reliable information. For most people, that will be their primary care provider, particularly their primary care physician. And certainly go onto our website or the CDC's website. I assure you that is honest and truthful information based on data and facts. And if there's anything in there that's subjective, we will point that out. And so that's what I encourage people to do who are still hesitant, particularly parents right now who are wondering whether or not their child who's age 5 to 12, whether they should be getting vaccinated. You can find the information out there, and I can assure you again, these vaccines are both safe and effective. And that's what the message that we need to, people to take home from this briefing. We need people to get vaccinated. We need to get the virus under control. We need it not only just to keep everybody safe, but we need it because our hospitals are full and we can't take any more patients than what we would typically be caring for. We want to stay open. We want to serve our communities. We want people to be safe. We want Maine to be the healthiest state in the union. And this is just one more effort that you can do to help us in that endeavor.
And one final quick question. You already talked a little bit about what Northern Light's vaccination efforts are going to be. Could you talk a little bit, anything you didn't say about their efforts on the ground in Penobscot County specifically, that you didn't say earlier?
So in Penobscot County, traditionally, Penobscot Community Health Centers has been the leader in doing vaccination efforts in our schools, and they will continue to do that as far as COVID-19 vaccination goes. We will play more of a supporting role for them. If that means distributing vaccine or adding assistance, we will do that. That's again, what we've traditionally done both with influenza vaccine and what we did earlier on in the pandemic. There are other places in the state where they don't have a federally qualified health center that has the ability and the manpower to take care of that, and so we fill in those areas. Frankly, in the southern part of the state, Northern Light Health plays a big role in doing school-based vaccination clinics. We will support anything in Penobscot County as we need to, though.
Okay, thank you for those questions, David. Dr. Jarvis, I'll have one quick question. I saw this late in the feed, but David Horowitz only got one question in, and so he sent me another one. How often are people who are vaccinated getting COVID and are asymptomatic? Do you have an answer on that?
I don't have a specific on that. That's a tough question, right? People are asymptomatic, don't necessarily get tested, and so it's tough for us to answer that. We certainly know that breakthrough cases are occurring, but breakthrough cases still are rare. I want to point out again, as we start looking at the numbers, that the people that currently are testing positive, and certainly those with severe illness, the overwhelming majority of them still remain unvaccinated individuals, and so vaccine protects us. And even if you were to get COVID, if you've been vaccinated, it's less likely that you will have severe disease or long-term consequences from the disease. So very important to get vaccinated. So thank you again for the ability to repeat that message.
And I think that's going to wrap it up for questions from members of the media today. Dr. Jarvis, Paul, thank you very much for attending, and thank you to our members of the media for attending as well. Those of you who have indicated you wanted the video, well, look for that in your inboxes in the next hour or so.
Thank you.
Thank you.